I asked 20 doctors from YouTube to give me one health tip they give their patients as it relates to their medical specialty. This video might actually save your life one day. I'll go first. My name is Dr. Mike. I'm a family medicine doctor, which means I am one of the only specialists qualified to treat most ailments and provide comprehensive health care for people of all ages. One health tip I give my patients is to never stick anything smaller than your elbow in your ear canals. This is because too many people are using tools like Q-tips to pull out earwax, when in reality, they're only packing earwax deeper in and even damaging the skin, potentially leading to an infection.
Hi, my name is Dr. Glockenflecken. I'm an ophthalmologist. Eyeballs. If you think you've lost a contact lens or an eyelash in your eye, don't worry, it cannot migrate back into your brain. That's something a lot of people worry about. It's most likely just stuck underneath your eyelid. You have tissue layers that prevent things from moving further back.
Hello, my name's Ed Hope. I'm an NHS doctor working over in the UK in the emergency department, or as you may know it as the emergency room. It's super useful for us if you ever end up in the emergency department if you bring a list of your medication and any diagnosis you have and the dates of any significant illness or operations, and be prepared for a long wait, so it's always good to have your phone charger too.
I'm Dr. Danielle Jones, known online as Mom and Dr. Jones, and I am an OBGYN physician. That means I specialize in pregnancy and gynecologic problems. Stop throwing out your favorite undies because of period stains. After an initial rinse, grab some powdered meat tenderizer, sprinkle it on the stain, and let it sit for about 30 minutes. Throw it in the wash as usual, and when you take it out, the stain will be gone. Bromelain, the active ingredient in most powdered meat tenderizers, is actually a proteolytic enzyme. This means that on the steak, it breaks down proteins to make the cut more tender, but on a blood stain, it breaks down proteins to pull the stain out. It sounds like magic, but it's actually science.
Hi everybody, I'm Dr. Winters, also known as the Dentist on social media, and I am actually a dentist who specialized further to become an orthodontist. And we deal with moving teeth with braces and aligners. Little hack for you, because you've probably been brushing your teeth wrong your entire life. Most people brush their teeth completely flat, side to side like that. What you actually want to do is angle it up at a 45-degree angle and get up underneath the gum tissue as well as the tooth, because some of your teeth hides up underneath the gum tissue and you never clean it. So turn that 45-degree angle, brush your teeth for 2 minutes, and your teeth will be cleaner than they've ever been in your entire life.
My name is Dr. Dana Brems, and I'm a podiatrist, which is a foot and ankle surgeon. One crazy foot hack is one of the most effective topical medications you can use for toenail fungus is actually just Vicks VapoRub. It has eucalyptus and menthol, which are both antifungal.
My name is Dr. Anthony Yoon, and I'm a board-certified plastic surgeon. One simple and natural way to plump your lips is to put a drop or two of food-grade peppermint oil into your lip gloss, and then mix it up and then apply the gloss onto your lips. It should create a very mild tingling sensation, and your lips will gently plump up a bit. If you're not tingling, then put a drop or two more in and try again. But if your lips start to burn, then wipe it off, throw it away, and start over again with less peppermint oil.
Hey, my name is Dr. Alok Patel. I'm a pediatrician, specifically a pediatric hospitalist. So I take care of babies, kids, and teens who have been hospitalized for a variety of different reasons. Suck up some snot. For real, it's not that gross. Babies and toddlers tend to have runny noses, a lot of mucus during cold and flu season, which lasts forever, and you can help them out with a nasal aspirator or a nasal suctioning device. It clears their nose, helps them sleep better, eat better, improves their mood, and potentially prevents a problem from getting worse. It's also kind of satisfying.
Hello, my name is Dr. Austin Chang, and I'm a gastroenterologist, otherwise known as a GI specialist. One important hack I can offer for the gut is that colorectal cancer, which is the second leading cause of cancer deaths when men and women are combined, is often preventable. We have ways to prevent this cancer, and it's often with a procedure called a colonoscopy, where we can actually take a look inside the colon, find these precancerous growths before they turn into cancer and remove them. And that can actually help prevent cancer from happening.
I'm Dr. Curran, and I'm a general surgeon in the NHS. My job has me dealing with basically anything you can find when you rummage around someone's abdomen. One day it could be cutting out bowel cancers, the next day slicing out badly behaved gallbladders. The most underrated life hack for optimized bowel health is probably just eating more fiber. Just increasing your fiber intake by 10 grams of fiber a day reduces your colon cancer risk by 10%. It's not a bad exchange. 10 grams of fiber is a banana and 2 slices of bread. Easy.
My name is Dr. Michael Cellini, and I'm a dual board-certified diagnostic and interventional radiologist. One secret I'd like to let you in on regarding my field of radiology is that we see everything. If you swallowed a chicken bone, we see it. Put something somewhere, we're gonna see that too.
Hey there, my name is Dr. Sanjay Juneja. I am a hem-onc specialist, otherwise known as hematology and medical oncology, which specializes in blood disorders and cancer. One of the biggest tips that relates both to hematology and oncology, and it's not very provocative, is that we need to register for bone marrow transplants. People are waiting and hoping and praying that somebody swabs their mouth and sends it in because they have a short amount of time in which they'll live and have control of their cancer, their leukemia or whatever else, and they're just hoping this random person in the United States or Germany or wherever actually is a match that will save their life.
Hey guys, I am Dr. Shireen Idris, a board-certified dermatologist, and I am wearing sunglasses indoors because I just had LASIK eye surgery. One tip that I really think you guys have to think hard about, especially when it comes to cosmetics and laser procedures, is the following. Would you go to the dentist and get your teeth cleaned without brushing your teeth every day? The answer is probably no. A solid skincare routine is the anchor to any sort of cosmetic procedure that you get in office.
Hi, I'm Rena Malik, a urologist and pelvic surgeon. That requirement of drinking 8 glasses of water a day is a myth. This was recommended by the U.S. Food and Nutrition Board in 1945. However, it wasn't based on any sort of evidence-based scientific research. And they noted that most of these fluids are found in prepared foods. So unless your doctor tells you otherwise, drink when you're thirsty. If you are outdoors in hot temperatures or exercising, consider drinking a little bit more. The trick is to look at your urine. If it's a light yellow color like lemonade, that means you're drinking enough. If it's any darker than that, consider drinking a bit more.
Hello, my name is Rohin. I'm a consultant interventional cardiologist from the UK. Every adult should know their blood pressure and their resting heart rate. I'm not saying you should check it obsessively, but I think they can be really useful sources of encouragement if you're embarking on an exercise program. You can track both of them getting better, particularly your resting heart rate coming down in just a few weeks. And that's important because the more you can lower your resting heart rate through exercise, the longer you live. They actually correlate with one another. So if you can, get out there and exercise regularly.
My name is Dr. John Patton, Doc JP3, and I'm a board-certified anesthesiologist and a regional anesthesia and acute pain medicine specialist. This tip goes out to all my pregnant patients out there. At the end of the day, it's totally your choice if you want to have epidural as part of your labor plan. But if you do, it can be very difficult to place an epidural in someone who's in labor. You have the baby who's kicking and punching and ready to come out. You have your uterus that's contracting and doing its thing. And you have mom who's screaming oftentimes, "Where's the anesthesiologist? Get them in the room now. I'm ready for my epidural." And for us, really getting into that position that we need you to get in to allow us to place that epidural and get you more comfortable is extremely, extremely important. We need you to have your head down, your shoulders down, all right? You're gonna be forming the letter C. You're curving your back out towards the anesthesiologist, like almost like, you know, a shrimp or an angry cat. That really allows for those spaces back there between the spinous processes to open up so that we can get that epidural needle in and place that catheter into the epidural space so we can start giving you the medication and getting you comfortable.
Hi, my name is Dr. Antonio Webb. I'm a board-certified orthopedic spine surgeon here in San Antonio, Texas. I know a lot of people have back pain. One tip is to keep your weight down. The more weight that you have being applied to the cushions or to the disc in the spine can lead to degeneration, and that can cause back pain. It's said that each additional pound of extra weight leads to 4 additional pounds of pressure across your disc. So if you have 200 extra pounds of weight, you have about 800 extra pounds of force that is being applied to your spine that can wear down your spine, the disc, cause arthritis, degeneration, and lead to pain.
Hi, my name is Dr. Brian Suter, and I'm a non-surgical sports medicine doctor who focuses on treating orthopedic and musculoskeletal injuries in athletes. If you have a new injury like a sprained ankle where there's a lot of swelling, a good way to help reduce the pain and inflammation is through the use of ice. A great way to do this is to actually take a bag of frozen vegetables like peas or corn and use that to help ice the area. You can throw it back in the freezer when you're done, and it helps to really conform to the joint you're trying to ice. Just don't eat it afterwards.
Hi everybody, this is Dr. Jessie Gold. I'm a psychiatrist, which means I look at the brain-body connection, or really, I'm a feelings specialist. The tip that I would give is the tip I give myself, which is take time to ask yourself how you're doing. And don't just do it occasionally, do it every day. It's really important that we give ourselves time to recognize our own feelings and emotions and not judge them. Feelings are not good or bad, they're just feelings, and we need to give ourselves space to acknowledge them and deal with them. Literally everyone can benefit from therapy. I'm well aware that that is a privileged response and access isn't available for everyone, but don't just see therapy as something you do when you have a problem. Think about how it can make you better and look at it from that perspective. I go to therapy every week and I really find benefit to it. It makes me better at my job, it helps me care for patients better, and helps me in all aspects of my life.
What's going on, everybody? My name is Dr. Cedric James Franklin Rutland, and I'm a pulmonary critical care specialist, which means I focus on diseases of the lung and I take care of individuals who are admitted to the intensive care unit. The number one tip that I have for individuals: don't smoke and pay attention to your environment. I know sometimes we can't control where we live, but we can control what we put in our mouths. And if you're putting a cigarette or a vape pen or a marijuana cigarette in your mouth, it is going to cause some degree of inflammation in your lung. I don't care what anybody else tries to tell you. That is 100% true.
Click here to learn how I gained 10 million subscribers and maybe pick up some YouTube tips for yourself. Huge thank you to all the doctors who helped me make this video. Their channels are linked down below. As always, stay happy and healthy.